Mighty band.
Yeah, okay. On behalf of Barb, welcome, everybody. And welcome to the Zoom folks. And by the way, be active on the raise hand thing, just in case I can't detect facial agitation and knowing that you need to be on it. And especially because it's going to be real discussion today. So definitely don't be shy on that. So it's a little bit of a different day. We're going to do the minutes and then the reports, up to the minute from our mighty team here. And then we're going to do the takeaways sort of around the room and kind of one takeaway per person, just to get the discussion going. And the rest of it is going to be, what do we think? What are we learning here? And then maybe what are the implications for the work that we do? Sort of going forward with all the information. So that's what we're going to do today. Start with approval of minutes. Everybody have a chance to review.
Move to approve.
Second.
Approved. Jen usually go first, right?
Yeah.
All right.
Yes. Jen Eilson, Director of Health. You all have the reports, so just some quick highlights. The building permits are obviously picking up. It's our busy time of year where septic installed and all that kind of came to a halt because of February was pretty awful weather-wise, and with the frost layer and not being able to actually do the install. Which is also why community health, the walking club was postponed because the bitter cold and the weather and the trails covered in snow and ice. So we're hoping to bring that back in the middle of March as the weather continues to improve. Some updates. On March 18th, Voices is hosting a community preparedness training, preparing families in an emergency. That will be at the library at night from 6:30 to 8:30 with my preparedness coordinator, Nick Jossam, who's also our regional coordinator, Russ Kimes, our emergency management director, Chief Albie Bassett, and several other panelists. And it's hosted by Voices. So if anyone wants to register for that, the link is on the town website under the news item. And next week's coffee talk topic also was sent out through Everbridge, through the health group, about organic versus conventional diet. It is National Nutrition Month. So Shannon will be doing that at Lapham. Radon test kits, we did receive over half back already, which is really good. Only 2 were extremely higher levels and different parts of town. So there was no connection to anything. And then we're also beginning to get the farmers market stuff beginning to trickle in, all those permits, because they open on April 26th, my birthday. So that's why I remember that date. And that's pretty much it. You also have all the charts from suicidal ideation and all that. And as we see, it's still the same age group, the 10 through 17 with the higher numbers. So as we talk later about other things, and we can bring that all tied together. Yes, Jim.
I had coffee with Paul Reinhardt last week and was talking about the family support that he provides. I was interested, and I just looked at your report from the state on marijuana overdose. He is thinking that that's grossly underreported and continues to be a big problem, because part of what picked up in the health survey also was the fact that there is a lot of the, and this was his concern, a lot of the people that were in the survey, which was reflective of the town basically, believed that marijuana usage was part of growing up, right? And it was catching up with alcohol.
Yeah. Well, and to your point, it is, all those numbers are, because that's only people who actually end up in an ED, an emergency department. So those that happen at home or have the episodes, yeah.
With more use,
That will
we'll get more.
definitely.
So be something to watch.
Hmm.
Okay. Thank
Okay.
you.
I'm up.
Yeah.
Marcy Rand, Director of Human Services. I will also keep it very brief. You guys have all of my numbers in my report. I just have a few exciting things to bring up. John Knight, you are our first donor to our donation button, so thank you
Oh.
very much. You get a gold star. We really, really appreciate it. And we wanted to know if you got a receipt. We are working with Invoice Cloud, and will you check and let us know? Thank you.
I was also just comment that where it takes you once you make the donation is like to the taxes page, and you're like, wait a minute.
We got
what
that.
happened?
We noticed that because we got a notification that you donated, and it said, if you have any questions, we're like, no, that's wrong. So we did ask him to fix that. So there are going to be a couple bumps, but we did get our first
And
donation.
I also tried the Amazon donation page too.
You did, thank you. So that's next on my list. So when we were doing this donation button, Enza was like, why don't we do an Amazon wish list also? And we are going to start a home goods closet, like not in the food pantry. We'll do that in our office, and that will be by appointment because a lot of like personal care items and stuff aren't covered by SNAP. And
That's great.
so we're gonna do like a home goods. So thank you for checking that. We have an Amazon wish list as well. And the last but not least, Zoombox and Caffeine and Carburetors have created a fund that is going to be managed through Touch a Life. And they are going to be able to provide funding for up to $1,000 in car repairs. And so any of our clients who need car repairs, that's excellent because
That happens to be
we weren't
perfect for my
able.
use. Can I get on that list?
I know.
You don't qualify.
We aren't able to cover car repairs. We're not able to cover medical expenses. So what we try to do is sometimes pay an electric bill so then they can use that money to pay the car bill. But this is going to be so helpful. So yeah, and car bills are expensive, so they are willing to cover up to $1,000. So
We should do at a future meeting, a call out on that, like a formal,
yeah.
because that's really
Oh,
cool.
it's fantastic.
Yeah.
Yeah, no. And I'm gonna get like a little blurb, and as soon as it's in Deanna's newsletter, then I'll have you
Great.
do your
I'm so
magic.
happy you did that. It was great to
Yeah.
get the donation online.
It is.
Do you have any wild guess as to how much we're going to raise with buttons?
No, you were.
Sky's the
literally-
limit.
You can give as much as you want, and John was our first donor, and it was like within like a half hour of us sending out the
Have you
emails.
had any others?
Not yet, but that's okay. But we haven't
But
really.
they haven't
Yeah.
We
launched it.
haven't really like advertised it. It's gonna go in Deanna's newsletter,
Oh,
and
right.
once it's in
Good.
Deanna's newsletter, we will really.
Yeah, John's setting the pace.
He
I
is.
don't know about you guys. I'm
Chop,
feeling a
chop,
little
guys.
peer pressure.
I was thinking John's gift is probably so big, none of us has to.
It was very generous, I have to
I
say.
don't know.
So
Very
that's
cool.
the story.
Okay.
Great job.
Okay, all right, so let's jump into the survey stuff. And again, there's a lot we can kind of go on. I'd ask everybody to, a minute or so, something like that, just to bring out the major takeaway, and then we'll have time to move on from that. But also, let's start with, so to my right, Jen.
Okay, hi, Commissioner Jen Laddick. And of course, this was such a hard task for me to narrow anything down and not try to think of 500 contingencies. But a good thing that stuck out to me is that I was pleasantly surprised to see 66% and 71% of people report no barriers to mental health services and physical health services. And obviously something in the 90s would be amazing. But I do think it's a great start and a testament to the work that's been done already. But then, you go down a little further, and for children, 1 out of 3 parents do not know where to get help for their kids' mental health. And I think that this came up in the presentation, this idea that sometimes the people who most need something have the least awareness about where to get it. And I think that we as a commission could have a positive impact by helping with the information sharing. We can't necessarily provide more services, but we can do a lot to make information available to people who report needs but don't know where to go. And just to add on to that, I would personally like to dig into a little more the family and community norms that were reported. And I hope that the Community Foundation does too. I feel like Lauren mentioned it, so I think there's a good chance they will. But the numbers there around monitoring, communication, and modeling seem nuts to me. Unless almost all the families have just 7-year-olds and 9-year-olds, but for families with teenagers, the numbers around, like I said, the monitoring, the communication, and the modeling seem a little bit backwards to me. It would be really great to get some teen feedback and see if they agree with what their parents are saying about those kinds of discussions. And I also worry that there's some significant risks in our teen community that aren't really captured here. Emotional well-being, stress, anxiety, and mental health are at the top, which I think is appropriate and not surprising, but substance use and gambling are near the bottom. And I think, whatever your opinions are on whether or not that's a normal part of being a teen, we still, they still should be on people's radar and things that we're looking at. So those would be kind of my main areas that I feel like we could look at as a commission.
Awesome. John?
Commissioner John Knight, I'm picking up on one of the themes that you picked up on was the knowledge of mental health and substance use supports for children. And I think what struck me is, I think there's so many different levels of mental health issues or substance use issues that I don't know that we've yet as a community done a good job of dealing with gradations. Because let's say your kid has just started to experiment with substance use. You don't necessarily need to put them into a treatment program, but it's an education process then for the parent and for the kid. Or similarly, if there's a mental health issue, school resources and other things. And so for me, I thought it would be useful to try and dig into the different levels of support that are available so that if someone has a very significant problem, they know that the assessment program is available at Silver Hill Hospital. But if they have something where, let's say they have a sixth grader or seventh grader girl, maybe they need something like the Confidence Club that's offered through LiveGirl, or they need some of these other supports. So I think part of the issue is that we tend to think of it in an extreme situation and not, it's a learning process for a parent and a child or a guardian and a child as they go along.
Awesome. Okay, let's go on the Zoom. Raquel.
Get myself off mute here. I think some of the things, just to kind of echo first off what Jen had said, the parental norms I thought was interesting. Numbers seem potentially overestimated. The one question I have is if you think about the Surgeon General report from, I don't know, maybe about 6 months ago on parental pressures, there's probably also this expectation to overdo some of the monitoring and some of the, knowing exactly where they are at all times and over communicating maybe to a certain extent and being able to reach everybody with phones constantly. And so there's probably a balance there that I'm not sure is teased out in the questions that were asked. So that could be kind of an interesting thing to try to understand a little bit better. One of the things that also kind of stands out as I'm looking at Marcy's report on vulnerable populations, the survey does clearly define a couple at-risk groups in our town, and I'm wondering if we're able to capture maybe some more of those people based on the potential definitions put forward by the report. So particularly people who are caring for multiple generations. I don't know if we can kind of try to support them in a different way and kind of, identify them in some way. It's probably harder to identify, but if we can think creatively on that, that could be interesting. And then one of the things I brought up, I guess the last meeting that I would be interested in understanding more is that thriving piece for the people who are thriving in town. What are the characteristics? And can we start to put a positive spin on, encouraging those things that have been identified as, kind of more of those thriving or flourishing markers in town?
Great. Russ?
Look, excellent points brought up. I'm going to give you just page references in the book, and that way it'll be just easy to look up. The first one that caught me was page 47, and for parents to indicate prescription drugs not subscribed to them, that 44% somewhat easy for their kids to get, and 20% very easy. And I think that is, for me as a healthcare provider, somewhat scary, that the accessibility to prescription drugs that are not prescribed specifically for the child. The second was, of course, always, and I think builds upon everything that's been said, and that's page 40 when it comes to depression and anxiety that has been experienced by our children. Feeling nervous, anxious, or on edge several days is 43%, and worrying too much about different things, or let me go back, feeling down, depressed, or hopeless several days is 23%. I think those two numbers are alarming. And the third and last wasn't on the survey, but something I know that all of our healthcare providers around the table are tracking, and that's the increase in anti-vaccination that's occurring. And if you look at, measles, that is an outbreak in the Midwest, and you look at polio that's been identified in 5 European countries, and the flu vaccines and COVID, I think there's a real movement for anti-vaccination, and parents willing to appeal. And you hear a significant increase in parents that are appealing to not have their children vaccinated. So that may be more of an educational program, and certainly outside the scope of, I think, what the survey took place. But when you see the outbreaks on things like measles and polio, which we all felt were eradicated based upon childhood vaccinations, that's a little concerning for us as healthcare providers. So those are my three.
Great. Alyssa?
Commissioner Alyssa McKenzie. I feel like one thing that really jumped off sort of the survey from me is what an opportunity we have to all be speaking the same language. I do wonder if some of sort of our questions around like some of the numbers is that this is the first time we might all be defining community well-being. I know that we are very like success oriented in New Canaan, but is this an opportunity to sort of shift the paradigm to actually what's most important in terms of success? The most successful you can be in your life is to really be focused on your well-being and your family's well-being. And with that said, it's just hard for me to sort of silo and look at the different priorities separately because of the way my brain works, but also because I think it's those layers that are maybe where we can make the most impactful change. So just in my world, Lauren and the survey creators were really gracious to let me and my mother meet with them and talk to them about Sandwich, the Sandwich Generation. There was a time in my mom's life where she and my dad were caring for children under 18, adult disabled children, and their parents as well. And that is so layered in so many ways, and it can sort of cloud even your ability to take a survey like this because you don't even know where you fit in. And then just me myself as a disabled woman, I think about domestic violence. That's where I'm a liaison. And I think about the fact that disabled women are 40% more likely to be abused. And that in the disability community, we have such a higher rate of abuse. So my priority would be, as much as we're able to, as we go forward, to look at the intersectionality and see if maybe looking at those layers and not trying to separate them, but looking at them, if that might help us get to the root, because I think that's what the survey is helping us to do, is to unearth sort of what's actually like substance misuse or mental health issues often are a symptom of something deeper. And so I know that's like not the most satisfying answer about what my priority is, but I just want to see if maybe from there, do we start to think about focus groups? Because I know that the survey creators and Lauren had said that that's something they would love to dive into after the second survey. And so maybe we're thinking about, well, what do these focus groups look like if we have, you know, any sway on them?
Wow, the team is delivering here. We're gonna skip over Jen and Marcy for now because they're the heavy hitters. They're gonna bat clean up. And I don't want their wisdom to influence everybody too much, but we're getting to you, just so you know. Tom.
Okay, Tom Ferguson. Just the headline is 1,500 people, mostly women, and not many young people under the age of 30 in the survey. So I feel the survey is not necessarily a complete, accurate cross-section of New Canaan, but it's apparently it's pretty good to have 1,500 in a populous town of our size. So, and the people who filled it out took it seriously, and the answers tell us that. On the whole, New Canaan people are in pretty good shape. If you had done this survey in some other places around the country, it would have been a lot more alarming. That being, and the number of people, the percentage of people in the at-risk categories is relatively low compared to the rest of the country. So that's not a surprise, I don't think, but just some perspective we should keep. The areas of concern have been generally mentioned already, but the high percentage of people not knowing where to access mental health services and substance abuse particularly, that surprised me. And that seems like an opportunity for the commission to make sure that information gets out. There's just so much going on. I'm surprised that that's the case. And the high level of concern about children's mental health and all the different categories from anxiety, depression, substance abuse, that did not surprise. And that's like the top concern in New Canaan. I think if you just did and that was confirmed. We kind of all knew that. It was at the top of our lists. Now, my notion is that kids live in a parallel universe that we can't see into and they can't see into ours. So how do we cross into that and learn what's going on there? Maybe we do a survey of teens, although I think that's a challenge. But that would be a good undertaking to try to get a better understanding from the kids' perspective. I'll stop.
Great. Jim.
I agree with all that's been said. As you might expect, communication is what is coming loud and clear, and there's a whole bunch of different needs there. I happened to talk to Lauren Patterson yesterday on a whole different subject, but migrated into this from the standpoint that my concern is much like Tom's, was the sample as pulled is indicative of the community, but in point of fact, senior men are grossly underestimated in that, we think. Anyway, so from the standpoint that the Alliance met yesterday or the day before, came to the conclusion that communication was the number one thing coming out of the survey. Nothing, according to Lauren, was decided other than the fact that communication, but the communication problem as a marketer is interesting because there's so many different demographic cohorts in this thing to serve, and with so many different interests. And so behavioral health in and of itself is this kind of confusing mishmash of issues and people, et cetera. So it's not an easy problem to solve, therefore not an easy problem to communicate. So one of the first things I would recommend is that, and did yesterday, that we should, as a commission, be part of the communication strategy and program. And so that's kind of goes without saying. And again, we've identified a number of the issues already. The other one is the piece that I'm making a pitch to the men's club to follow up the recruiting pitch on being part of the survey. I still believe that actually it goes all the way back to the original behavioral health, or the Silver Hill program now, as it's called. Only 8% of seniors are participating in that. There are some reasons that I can dig into, sort of, but I'm concerned that I know a lot more seniors that are under stress, anxiety, and all of the other classics that are not showing up. Now, the problem is, and AARP did a national study of behavioral attitudes. Seniors tend to believe there's not a problem unless they're crashed and burned, or else there's somebody in the family that's crashed and burned. There's a high need for education. So one of the things I'm recommending, which comes out of this deck that you have in front of you, is to do a retab of the study that focuses on seniors and does a deep dive into, one, looking at whether there's a substantial enough respondent base among men, senior men particularly, to be able to do some projection. And so I will be talking to the research vendor to see. But if indeed that holds, then again, we could retab, and we have $4,700 left over for senior health from the original senior telehealth program that was closed last year. And I'm going to recommend before we're finished that we spend that money looking at, or that we get agreement in principle from the commission to see what we can buy for $4,700 and whether that would really be fill in a missing piece. That's it. Oh, and the other thing, as a side, is that you may recall the commission sponsored 2 AARP national requests this last year for the Waveney Telemed and for the Silver Hill program. That was done under the Livable Communities initiative. We are not looked at the moment as by national organizations as a livable community. And so one of the things, it costs very little but time. And one of the things the commission could do very simply and have major impact is to get recognition on a national basis that we are the optimal livable community. So I'll save that for another day.
Great.
Thank you.
I'll just say a couple of quick things. For me, one of the things I struggle with a little bit is not having a sense of trend, because some of these numbers look one way just as a moment in time, but the movement is really important. And I think that's something that I want to make sure we repeat this at some point, like the financial well-being, that 13% who really are, struggling to get by. I think that is up. To me, that's something that I kind of miss. I don't know how we deal with that. I was really impressed by the overall awareness around mental health. Like, everybody knows it's an issue, or I'm overstating slightly, but it's the awareness out there. In particular, there's real awareness of the impact of technology, and it's not just kids, it's adults too. They're struggling, and there's that self-awareness. I was surprised by how we've all learned about that. On the flip side, I was a little disappointed to see limited correlation between well-being and community involvement. The group stuff that we've been talking about. There's a table in here that shows us not a big difference between people who are not involved and people who were involved in activities, and that feels off to me somehow. And I think there may be better ways of getting at the connectivity theme that we've thought about. But I think it definitely relates to the way we prioritize connectivity I think there's a lot of deep research which says that's really important, but it didn't come out in the survey. So with that, let's go to the real deep experts. Like what really jumped out at you guys on this, and then we'll open it up to a broader discussion.
Well, I mean, I thought it was a good survey, and I thought it sort of covered everything. What I was sort of most impressed by was there's that age group between 30 and 59 that knew where to get services for like their children, but had no idea of services like for themselves. And that's like such a group that is under so much stress, you know, like they are parenting or they are helping older parents and they're worried about their high school kids and they can get all those services in line for their kids, but they don't know how to take care of themselves. So I think like that's a big sort of part of the survey that was noticeable to me. I also think that there should be focus groups on specific groups, like this 30 to 59-year-old group. Like, why is it that you don't know where to get help for yourself, but you can like make sure your kids are all covered? And senior, especially senior men, like what is it that's preventing you from finding out about this stuff? You know, is it just sort of an age thing that you know, stiff upper lip, or is it that you truly just don't know where to get this help? And I think that there should be a youth survey. I know that the schools do like a youth like school like climate survey. That's not the same. And I don't think a youth survey should be done at home. I don't think it should be done where like parents are looking over youth's shoulders. You know, I think it should probably, if the schools would be willing to have it done at the school where kids can feel comfortable answering the questions that they don't want their parents knowing the answers to. I think that would be super helpful. Last but not least, I think that we should focus on the positives. Like you all said, we have some really great numbers in here also. And I think it's Ridgefield that's going with like a trend of like, you belong here, kind of like, so not that like, oh, you don't know, you know, that you're not getting your services, you don't know where to get them. It's more of like, let's all make it a more positive and inclusive part of be part of a community type of thing. And I think when you feel like you're part of a community.
Yeah, I just want to make sure.
Yeah, no, that's fine.
I am done.
Discussion's about to erupt.
No, I was gonna say that I don't have when I was leaving the initial community-wide presentation, I was with my wife and another woman, and they said, well, it's not surprising for women in their 40 to 59 area, they're empty nesting, they're going through menopause, and they may be now trying to figure out next stage of life. So they said, you know, that may be completely unrelated, but they were also just commenting from their own perspectives that those were some of the challenges that they felt that contributed to these types of mental health concerns.
100%. And then on top of that, it could be that these women are also working, you know, so even if they wanted to get help and they get out at 6, well, no, I can't go talk to somebody at 6. I have to run home and make sure, you know, so-and-so got to softball and dinner's made and the dog was let out. And then all of a sudden, you know, there's no time for them.
So this little exchange was amazing. This is what we're going to do in a couple of minutes on everything. No, sometimes it's got to come out. Jen, headlines for you.
So to follow up on Marcy with focusing on the positive, one of the things that jumped out to me was, you know, the percentage not aware of community supports, where everyone keeps talking about the mental health. Well, on a good note, everybody knows only 11% don't know who to reach out to in an emergency or crisis. And I think New Canaan's done an amazing job, not just through COVID, but through storms and everything. And we have over 20,000 emails in our Everbridge system to, you know, communicate with our community. And now we're leveraging Everbridge, you know, with health, police, fire, Deanna, the first selectman's newsletter, and Public Works to increase that communication. Because again, to what was discussed earlier, communication is a lot of everything in life. And, you know, to be able to reach out of these are the things going on, I think is great. And I think to not just focus on the negatives, like Marcy said. There are a lot of positives in this survey. And, building off what Tom said earlier and what Peter and I discussed yesterday about the financial well-being, 13% doesn't sound, that are struggling to pay their monthly bills. That's low on a national, even a Connecticut scale, with around us. But if you read further into that, that's, up 7% over a year ago. So that's pretty significant jump that, like Peter just said as well, and this survey now is months old. Has that changed, and will it continue to change with, climate right now, which would and can impact Marcy and her human services group with not just, assistance or food pantry or any of that, just even cases. So I think it's important that Marcy kept that part-time person just in case, because you don't know. And, inflation doesn't seem to be going anywhere. So even though this is very low for a national or Connecticut level, it is very high compared to what it was just a year ago. And that becomes a domino effect with everything else, with, mental health and well-being and stress and, down to your children and everybody else. So it's a little bit of both, a little mixed bag. But I do think it's important that we get the children's survey, that, hopefully the Community Foundation can work with the schools on that, because Darien and Westport have already been doing surveys like this. And I think it's important to not just be about the school climate, but.
And there's momentum on that. It's being worked on.
Quick comment. One of the things that's interesting is.
Just what Jenna, you said.
Yeah.
Okay, so
This
free,
is a
the
direct-
free for all is now.
She was the catalyst though for a specific thing. The health department in Hartford didn't even have a behavioral health acknowledgement, I don't think, up until recently. And it was always part of the human service operation. But now there's a long-term planning includes behavioral health. The connection between mind and body has long been ignored by the state. And I think we are catching up slowly but surely. Again, the town of New Canaan is way ahead of most other places in the state because of Silver Hill, because of the Alliance and et cetera. But there's a whole need to recognize that we are in a major education issue, saying, well, it is health, but it's also human service. And that's going to be a challenge. But I think that's right. That behavioral health was not part of the, or that long-term planning was not part of Hartford.
Well, because there's separate divisions at the state. There's a
Well,
Department of Public Health, there's a Department of Social Services, and that's how it is across most of the state, except the big cities. But I think like Marcy and I work well together, and, she attends our, blood pressure clinics and blood sugar and stuff like that to do the social work side of it, where, we do have that interbred connection, which I think is important.
So listen, clarifying questions, reactions, again, wide open. It's super stimulating thus far. So whatever people want.
Peter, I think there's a way from everything that you heard, Commissioner Barks. I think there's a way to really bring and consolidate everything everyone has said. So the first thing that I heard, if I'm trying to consolidate and listen to everyone's opinion, which is very important, and our head of Health and Human Services, is that we can promote and certainly support New Canaan Community Foundation of maybe doing separate surveys of the geriatric population, senior population, as well as the children. The second I heard is communication. We have what is great about living in New Canaan, and Jen kind of led up to this, is you have so many different ways of communicating, right? Through the first selectman's office, through health, through human services already, and how many people they have there. Plus take all of the nonprofit organizations that we have in town. If we challenged them to focus on one of our topics to really spend time and energy and money marketing and communicating those services. I think that way we can bring that synergy together and we don't have to do it all ourselves or put it all on the town, highlighting to them that this is our recommendation, our priority recommendation. The third is I think something that Raquel and I and others I think have talked about. If all this comes down to a root cause that we want to move a needle on, certainly we see increased depression and anxiety. And the things that come out of that, which may be substance abuse, alcohol abuse, suicidal ideation rates, things of that nature. I think if we can find those one or two items that we can really focus on, trigger, I think it will have a pebble effect on some of the other utilization rates. And lastly, to go back to the survey, Peter, I couldn't agree with you more. This is a snapshot in time, and we don't know, what percentage completed, timing, things of that nature. We would like to challenge, I think, the Community Foundation that this needs to be an ongoing survey process so we can actually look at it as a commission. Here's where we started from. We have tried these different initiatives, and then this is kind of over time how we're moving the needle in a positive way.
Great.
I had a question. If we had a job to put together a one-page summary of who to call for all the issues that were highlighted, could we do it? In other words, we all say, well, we know where to go for substance abuse, but I'm not sure I know exactly where to go.
Well,
And-
that's what,
And
the Behavioral Health
Yeah.
Alliance,
Right.
like, unfortunately, there's not a lot of traffic to that website, but that has
Right.
everything on it. So,
Well, that's something
Yeah.
that nobody knows about, or hardly.
yeah.
Isn't it Laurel House that has the consultants that you can call, and then if you need various service?
That's
Yeah.
like calling 211, like mobile
Yeah.
crisis.
Yeah, but I think there's something with Laurel House, because I think when the Community Foundation was looking at these, that was another entry
Yeah.
point.
Yeah, the hub has a fairly detailed list also. The problem that you're both talking to is that most people don't know those exist unless their hair is on fire and they're having to
Right.
solve the problem of the moment.
Well, that's sort of what we talked about yesterday at the Behavioral Health Alliance meeting. It's like, we need to find where everyone is in order to
Yeah.
get that information out. So even if it means that we put up verbiage or a QR code, at the library, at the laundromat, at places that people go to, especially with domestic violence help, stuff like that. People who live in a domestic violence situation aren't really permitted to go out with their girlfriends or anything like that, but they do have to go to the grocery store. So, maybe we put something up at the grocery store with all of these, just be more accessible. We have to figure out where it is on a marketing kind of vision on how to get the word out and where these people are.
And I think it's also repetition.
Yeah.
So as an example, the Sentinel sends out a daily email, and if you scroll down to the bottom, they have a list of, here's a whole bunch of services that are available if you need them. So, there are places, but I think it's also the repetition because it doesn't sink in the first time, or person then refers back, gee, now I need it. Where did I see that? Where do I find it?
It seems thematically that the awareness of the issues is up. Mental health's on a lot of people's minds, but where to go is still the problem. And that's why the Behavioral Alliance was created, but that's where there's not as much progress as a simple way of, your little checklist on the bulletin board at home, okay, if something happened, what do you do? That jumped out here, that everybody's aware through kids and technology. And that's a really an interesting takeaway for me from all of this.
But what's missing actually, and that's why I want to do the senior look. I bet you if you go to the men's club on Friday, which average age is 70 at least. That basically you'd say, how do you recognize when you have a mental health problem? or one of your wife or your friend or et cetera, et cetera. So part of the education curve that we need to address is how do you recognize it and then how do you fix it?
Well, the men with mental health problems aren't at the meeting, but
Well, the ones who are,
I mean,
yeah, you shouldn't have any lonely people at the men's club, but in fact, we know there are a lot
exaggerating
of
a little.
lonely people. Yeah, anyway.
I mean, this root cause question is an interesting one. I want to just hear what people say on that because there's not much in here about that other than groups under certain conditions are struggling with awareness and what to do about it. The people who need it the most.
Yep. Correct.
That's a very sort of surprising theme, which gets a little toward the root cause thing. And I just wonder from a commission perspective, because we've been talking about upstream and the things going on, what are people's reaction to that theme that we've had relative to we've seen? And Raquel, maybe I'll start with you because you're very passionate about the thriving and the flourishing idea.
Yeah.
Now we have all this. How does everybody feel about that theme that we've talked about a lot?
You know, it's interesting because Peter, you mentioned that connectivity piece, right? Of there seemed to be a disconnect in the survey. Those people that were engaged it didn't necessarily correlate with increased well-being for them. But if I'm remembering correctly, and please correct me if I'm wrong, there were very specific set of circumstances of what you're engaged with, right? And so it wasn't necessarily a broad brushstroke of, do you feel like you belong somewhere? Do you feel like people know you and you know other people, right? So I'm not necessarily sure it got to the heart of what it actually means to be socially connected. And with that belonging piece being on the forefront, right? Creating a community where people feel like they belong is probably the heart of what we all talk around. And that's obviously the flip side of loneliness, right? So that certainly stood out to me as well. It just seemed very specific and kind of like check boxes that they were trying to identify where people are engaged, right? And so I'm not sure it necessarily gets to the heart of that. I know they had mentioned there wasn't necessarily anything that stood out on the thriving side, but I didn't actually see those numbers anywhere. It could be interesting to just actually ask them to run the numbers of the people with high life satisfaction and see if anything pops there. And maybe they did, and there's just nothing statistically significant, so there's nothing to say, right? But that would be, I do think it would be interesting to kind of get at that root cause that, just keeps coming up. Alyssa articulated it really well earlier. And it would be interesting too if we can highlight that as they survey the kids in whatever capacity that ends up being, but really focusing on that piece.
I think I'd refer, and I think these are all great points. Page 37 and 38, I keep coming back to that because I think whoever's writing this up, it's important to go back to the root numbers. To Raquel's point, it asks questions as I felt cheerful and in good spirits. I felt calm and relaxed. I felt active and vigorous. My daily life is filled with things that interest me. And then it goes right to, little interest or pleasure in doing things, feeling down, depressed, or hopeless, and feeling nervous, anxious, or on edge. So I think it misses, to her point, I think it misses that connectivity piece where you're asking, do you participate in sports clubs and, other activities that may help make that connection, if you will, as compared to this is how I'm feeling right now, or in the last 2 weeks, I've felt X, Y, and Z. And if we're trying to truly move upstream, we really need to get to that connectivity portion.
I also, to that, I don't think there's a lot of highlighting connection between intergenerations. I mean, I think, Tom, you mentioned that idea that we're kind of in different worlds with our young people. If there is anything that stands out kind of currently in society is that I think we are pretty ageist, right? We kind of sit in our silos in our age groups, and that kind of intergenerational crosstalk We don't have a good sense of what that looks like in our community, and probably, and I'm not sure there'd be a national trend to compare it to, really, but that idea of kind of for the young people, is there a trusted adult? Or even for adults, do I feel like there's someone I'm mentoring? Those kind of concepts are kind of critical to life, right? And always have been, but our society currently is very, very age segregated.
I also, oh, sorry.
Jen, I was just gonna, were you struck by anything in the health area? Because obviously this is behavioral all over the place, but access to health and things like that.
No, again, like New Canaan's numbers are much higher, like from like mental health, like that they don't have to worry about money, financially. It says that, cost isn't an issue or a barrier or insurance, where that's a good thing, where our neighboring communities and nationally, it's the complete opposite. So I think that's a positive that that's not, an issue there's a lot of concierge doctors in town. Like, so New Canaan is blessed with some of that and access to the better healthcare and the needs. So I would take that as a positive out of this survey.
But there are 15 or 20% who are not.
Right. But
Which is why-
compared to national and state levels,
Yeah. Oh, yeah.
it's still, you're never going to have 100% that are.
Alyssa, you're some of the.
Yeah, Commissioner Alyssa McKenzie. I was also thinking about and maybe it's not a useful exercise, but how people were taking the survey. And especially if you look at the people who are really engaged, but maybe don't feel like they're getting at that connectivity piece, I hate the idea of high and low functioning anything, but there's a lot of, for lack of a better word, high functioning in this area where we want to appear a certain way. We want to feel like we have it all together because we feel like everybody else does. And so maybe we are really involved in the community, but I know I'm beating a dead horse. Community is a privilege. It's not a right. It's not just your neighbors. And so there's also nothing more isolating than being really involved and not feeling like you have that connectivity. So I don't know how we unearth that aspect of it. I think it's a language thing because I think, again, we're all talking about success and well-being differently. Even the word like resiliency, we want resilient kids, we want to be resilient adults. How do you achieve that? Kids are so resilient, but they shouldn't have to be. And what does that look like just altogether? What was I able to take that hat off and take the survey as I really actually feel, or as I sometimes get this inkling in my head, or was I taking it as I know this, yes, I know that, I know what to do because I figure everything out because I have to. That's sort of, I feel like an underlying piece maybe a little bit is not speaking the same language going into our first survey, because that makes sense, why would we be? And the communication and the education that could come out of that.
I'm liking that you belong here idea. And since Tony Phillips, who's the head of human service in Richfield, used to be here, I talk to him frequently. And basically, I'm thinking that as we're talking about the communication and education part of what everybody agrees needs to be done, you need a couple of overall umbrellas, and that one of those may be to become the livable community as one of the tools, along with all the other communication vehicles that we have in this town. I mean, the beautiful thing about why this place is a livable community is because we talk to each other. So from the standpoint, we need some overarching thing. And I think that focus groups are a great idea to begin drilling down. And I think getting a retab of this seniors look is going to be helpful, beginning to continue to ask questions. When we get to youth, and we should be involved in the youth survey as a commission.
Raquel, I think you were trying to chime in a minute ago. Or maybe you weren't. Oh, she frozen.
Sorry about that. No, I was just gonna piggyback on something Alyssa said, but it's okay.
Well, I think just to Jim's point, and maybe we can close the door on this one. For those people that are going to the men's club and very active in the men's club, those people that are very active in clubs or sports and athletics, that survey is going to be completely different than those seniors who feel isolated at home, who are
Right.
widowers and who do not have that connectivity to the community in a certain way, who their only connectivity is Meals on Wheels, as an example. And I will tell you, those people that deliver Meals on Wheels, they feel like they can't even get away from that family member because that's their only really tied to community and their engagement. So I just think that we need to be very specific and identifying and I keep using the term drilling down, but we're not going to be able to do all of these things and do them well. And picking those particular areas and spots which get to our causal factor, I think again will have that pebble effect and start impacting the scores across the board. It's just choosing wisely, and I think community engagement is probably very, very high on that list.
Well, the other thing you're pointing out, which gets back to what Tom said, which I agree with, is the sample, the respondent sample is one of the reasons I want to drill down to look. There's the men's club group, we'll call them for lack of something better, and then there's the 15% that are living on the edge, and they're going to have an entirely different thing. I want to see there's only 100+ people in the men over 60 study. And I want to see how many of those are men's club people versus other people, as it were. So I think that, and part of the benefit of doing some focus groups is you could drill down without doing a major survey. Anyway.
John, with your EMT work, different perspective. How does this land with you?
I think one, we're a volunteer service. So if someone needs something, we're available free. So we're free, and that's one of the benefits of being in New Canaan compared to some of the other towns. Even the ALS services from the paramedic are free. I mean, they obviously, when they get to the hospital, it's a different issue. But the other is, I come back focusing on the children. We had a call a couple of months ago where we showed up and someone had called 911 anonymously for 15-year-old with suicidal ideation, and the police are knocking on the door, and the mom had no idea why we were there because he had been communicating with a friend, and the friend had called it in, and the mom was just completely shocked, just blown away. And so I think the issues around kids, particularly teenagers, there's just a lot of stuff that they have going on. And even, I think, Raquel, you made a point in your presentation to the country school that even if someone's playing sports, if it's competitive sports, that may not be relaxing. That may be incredibly stressful. They may be trying to make a team, and it's very different than going out for a jog or a nice long walk or doing some other thing. So some of these things that we say, oh, that must be a good thing if they're playing sport, it may actually be just completely the opposite. So
yeah, and I think, and this is what I was going to say, and it piggybacks on this, but then also Alyssa's comment. It seems like maybe one of the things where we can really add value is kind of trying to define what that well-being definition is in New Canaan, right? And not that it makes it feel like people are missing the mark, but kind of how do you support those structures that really foster that? Using the data from the behavioral health study, and kind of putting that together, a little bit of like, this is what it looks like or can look like. We're here to help, or there's different people in town available to help if you feel like there's a piece missing, and kind of having, because I know we obviously have a lot of aspirations to do a lot of education, but with limited time and resources, and where the Behavioral Health Alliance really probably should be stepping in to be that educational platform potentially. So I don't know, just to kind of piggyback on what Alyssa said of like really defining that could be interesting.
I want to maybe, oh, go ahead, Tom.
Just a couple thoughts. If I had to focus on a couple of areas, I would, number one would be a follow-up survey on young people.
Yeah.
I think seniors are less of a burning issue, but, and harder to get at, but I would say the young people for sure. And the other is, how do we, what would we tell people where to go? Do we have some place that tells people where to go for help? And the Alliance should be able to pull that together, I think, with the expertise on that group. But those would be the two priorities that I would have.
Yeah, one of the things, maybe to shift the discussion a little bit, is what in the survey, what are the implications for our work and our role in these kinds of issues? You know, certainly we took a stab at the priorities, and I definitely think that needs to be revisited and kind of looking closely at it. But there's a lot more data, and how do we fit into the overall ecosystem? Because, you know, there's a lot of voices, and we don't want to be all over you guys, and you guys don't want that. You're doing a beautiful job what you do, but I think, are there implications on role? Should we be refocusing on priorities and using our quasi-governmental position to communicate that out? It's kind of an interesting moment to reflect a little bit about the work that we do, because now we've got a little bit more conviction. Anybody have any thoughts on?
I do a little bit, in that I do think what I'm hearing is there are places that list resources in the Sentinel, you know, the Behavioral Alliance places. What maybe our role would be to amplify what's already being communicated, because it's there, but not necessarily getting to the people that need it most. And it sounds like such a little bite-sized thing. It's not as exciting and doesn't have such, you know, wow factor as the urgent assessment program or something like that. But I do feel like where we could possibly have the most and the best effect on things is our ability to amplify. And so we focus on, okay, so this group came up with this great one page, or this website has an amazing number of resources. So now we're going to really think about who's not getting it and how do we get to them. And that feels like it's in our lane, and it's something we can be good at, and might have actually a much bigger impact than it sort of sounds at first. It sounds a little empty suit, wishy-washy at first, but I think that once you really start identifying those things and taking steps, that might be where we actually have the most impact.
Marcy, your reaction?
Yeah, no, I absolutely agree with that. Like, I mean, there are resources out there, and there are a lot of like organizations that work really hard on their websites and stuff. So like, yeah, if like as a commission could like tout those in some way, because they are all out there. It's not like you guys would need to create the wheel. It's just getting it out there in a marketing way. I'm not, like I said, that's where it's like, I don't know how the information can be given.
I think we have like we have Everbridge, which is such a great resource with the donate button. I think that's a really good opportunity as we amplify that to say, oh, and hey, did you know about all of these other resources at Human Services? I could also see like if we could come up with like a window cling or something inexpensive that could go in any storefront that is a part of that You Belong Here campaign somehow, even if it's just taking you to a landing page on an existing website that has all of the resources. I think it's also, aside from the communication education, I think this discussion is at a really interesting time. I don't know how many meetings others have attended in the last few weeks with the different organizations and nonprofits that provide so many of the resources in this town. But for example, the New Canaan Abuse Prevention Partnership, the nonprofits that were on that call last month, were talking about their own funding and their own ability to even support people with cuts looming or cuts having already taken place, and how that's going to shift. So I think this is a really interesting time to be having this conversation in light of how do we also make sure that not just that we're communicating the resources, but that those resources will still exist, especially the ones that we've prioritized as the most important for our town. And, the survey reflects that those are the needs.
Russ, you're a really strategic thinker on this stuff. In your take on, I don't mean this super literally, but the so what factor. Okay, we've got this, now we're having a good conversation, but does this shift the focus of our work? Possibly, the prioritization, what can we do to be thoughtfully responsive? Because in my view, this is a really strong group from a lot of different perspectives, and what we're talking about matters. And what do we do with that to have impact? And you're in the middle of the whole healthcare ecosystem. What's your by the way, this isn't the final step on this. I'd love everybody to think about this for the next meeting, the so what factor. But what's your initial reaction?
Well, I always go back to, and I think I mentioned this earlier, not at this meeting, but I go back to our charter, right? And our charter is to present a strategy, if you will, and recommendations to our Board of Selectmen. And I think instead of maybe in the past, we have used Health and Human Services to put forward their budget to the Board of Finance and the Board of Selectmen. But if we could take all of the information, and you're right, Peter, I mean, with all the expertise we have at this commission, and both in staff as well as perspective, I think we could put together a series of recommendations to the Board of Selectmen that may be as specific as we need to identify a healthy community. And in a healthy community, we would like these nonprofits to take the certain leads on X, Y, and Z. We need to support the New Canaan Community Foundation to resurvey these groups, this population. We need to track over time, and we need to be very specific in our investments and how we're spending that money and how we're tracking and how we're giving both the Board of Finance and the town, Board of Selectmen, making the final decision on what the return on investment has been for doing that. And I think that from a strategic standpoint, we can always stand on our soapbox, which is our charter, and say this is what our recommendations are, well-defined, well-supported, with actual data, and give them very specifics. Challenge the Board of Ed on certain areas. Challenge all of these nonprofits, these great nonprofits that we have in our community, to come back to us with recommendations and coalitions and collaborations that they can work. And maybe that's the focus group. We help lead that to say, here's the area, and we like to bring to the table these 4 or 5 nonprofits, and Rachel and somebody else, Raquel and Alyssa for this area. And we really come out with a solid group of recommendations that come into that report, and maybe it can be done semi-annually. But I think it allows the Board of Selectmen, the Board of Finance to say, we're being very, they're not asking for just, $150,000 worth of grants that they're going to spread over. They're asking for a specific allocation supported by data, and they are going to energize the nonprofits to collaborate in a multidisciplinary area, bring some expertise. It could be a game changer. And I personally think that is a worthy cause. I think if we all went around and said what brought us to the commission and wanting to serve, it was to make a difference, right? It wasn't to just allocate $150,000 to 6 different nonprofit organizations every single year. And this is a way I think we can make a targeted approach and actually have a larger say in how dollars are spent and how we get some of these nonprofits that may be operating in silos, or to Tom's point, we don't know exactly what they're doing. We know that they have and get them to work together in a cross-functional way, and support a cause, a priority that we've identified as part of our charter, and get them to work together, and then look for funding if needed. So that would be maybe a little too loquacious, but that's kind of where my mind goes in terms of developing a strategy and actually operationalizing it.
I mean, I think that's a great thought question. I'd love for everybody to reflect on for the next meeting. And I'll go whatever direction people want to go in. Sometimes in a meeting like this, I like to go, okay, lightning round. What did you really learn here today? What impacted you the most in the discussion? Or we can just kind of continue to, just bring up sort of new ideas. But I do like the lightning round idea, because a lot of times in our own minds, there's synthesis kind of happening. That's what I'd love to hear. Like, I hadn't quite realized, but maybe blah, blah, blah. So I'll start just while everyone was looking at me with, confused face. The one thing I'm struck by is the balance between the tactical, like the empty suit things that are not that are quote boring, but I think are incredibly important. But also the looking out ahead, like the thriving and the definitional language. I was really struck by that. Like, do you feel like you belong somewhere versus the questions that are asked? And I think it's an interesting framework for us. And frankly, taking our cues from you guys, hey, what are the tactical things that don't sound like much, but are really necessary? But also to be looking out over the treetops a little bit in terms of what's coming and more root causing is what my interesting, I hope it's interesting takeaway. But we'll go around the room, and Jen, you have any kind of ahas from the discussion?
I don't know if it's an aha, but I feel like we have, for me, gotten closer to what doing something actually looks like. I feel like it's been so long that we've all wanted to be doing something or identifying what are we doing. And it's just so big and complicated, and there's so many factors to consider. It feels like today has brought us a lot closer to focusing in on what our role could or should be, and what we're going to do to get started on that. So that is a big positive for me. That helps me think and come up with better ideas. So thank you, everybody, for being so smart and thoughtful.
John?
I just have a small idea, which is, I think if we do focus groups, it'd be important to ask people whether the lists are enough. Because I wonder sometimes, even if someone has a list of resources, if they're not familiar with those resources, they're not going to call. They need a pathway, which is part of what the assessment program at Silver Hill was for. It was to help with the initial screening, and then it was a pathway into the provider network for resources. And so for me, it would be interesting to ask people in the focus groups, is the list enough, or do we need more?
Alyssa?
Yes, I was really struck by what Jen, Health Department Jen, said about the financial burden in town being so much lower than the Connecticut and national averages, but that it's increased 7% from last year, in light of that at least 11% of the survey respondents not knowing where to reach out in a crisis. And I think, like, disabled people, I know I keep going back to that, but that's sort of my wheelhouse. Like, we are erased out of society for a number of reasons, conscious and unconscious. And so when I think about how we're going to reach the people that we haven't reached yet, that's sort of, that's gonna be my homework for the next month, because I think it's really compelling. And I know, as Tom and Jim have brought up as well.
Yeah. Russ?
Look, I mean, there's been a lot of aha moments. I think, for me, looking, and I think everyone's brought a great perspective, which shows the diversity that we have
Awesome. Okay.
Yeah, again, agree, and lots of takeaways, really rich discussion, and appreciate that. I think that idea of, kind of ultimately what's our role, and so now what is really sticking with me, and what's that strategy piece? There's the practical, the, one-on-one type of work that is so necessary in anything health wise, but that's not what we're necessarily called to do as a commission, and kind of that more overarching um kind of line item of what's the bigger picture strategy. I think it's kind of, I want to sit with that um moving forward.
Jen and Marcy, what any?
Well, I think overall, I think, Jen, you kind of said it the best. It's like, the commission, everyone has like amazing intentions. That's why we are where we are. But it's like having a purpose now, and like narrowing it down to like education, creating trust in like the organizations that do provide some incredible services. I think you're right. I think there is like a trust issue for some people if they're not familiar with like certain organizations, but it's like a purpose now, like, and we can figure out how that purpose now will be like put into action.
Great. Jen?
Well, I said before.
Yeah, cool. Tom?
I would say that the 2 priorities, one is to do something about addressing the need that came right out of the survey, which is people don't know where to go access for help. And that should be an action point. I don't know if it's the commission, the departments, or the alliance, or all of the above. Yeah, but that's something that's sort of not too huge to undertake, and something very concrete. And I want to do stuff, but I don't want to do things just so I can say I'm doing stuff. I like to do something that will actually be useful to people. We should push to extend the survey to kids. I mean, I think that's going to happen. I'm not sure the commission needs to make a lot of noise, but we certainly should support that. We should send a report to the selectmen on this discussion, or maybe another discussion after this one, if we're not quite fully organized in our thoughts. And this is a hard ask for Jen, but if we could summarize today's discussion, that would be great, because I don't like the idea of having a nice ethereal discussion for an hour and a half and then going away and there's no record of it. So I'll be happy to help on that, but that would be and not an easy task, but important.
But it is something that I would,
Yeah.
knew this was going to be
Yeah.
and will do, and then send to everybody, because it's also a little more personal.
Yep.
And I want everyone to be able to look at it and say, that's what I was trying to say, not, oh my gosh, that is not what I meant to be saying,
Jim, and we're
Interesting,
start training
is
people,
the
but-
oldest, literally and figuratively, in the group.
Post experience.
Yeah, right. The principal mission of this group for the last 20 years has been strategy and policy for the town. And if you keep in mind that the last time we did something substantial against that was when the Board of Selectmen asked us to look at senior policy for the next 20 years back in 2010. That was a cohesive group. Tom and I spent a lot of time on it with a lot of really smart people, and we spent the better part of a year figuring that out. We had 4 or 5 actions that came out of it, from tax reduction to communication to benches. I mean, lots of good stuff came. We do not have the time nor need to do that, particularly because the opportunity to work with the Behavioral Alliance is there for the execution. And we have the communications opportunities to continue to work with them, but we can add more depth to the process and more strategic policy impact over if we can finish this discussion this next time. And there's some specifics that I'm taking away from this in terms of what else we need to address. But I see that we've locked on to behavioral health as a priority. Now it's time to figure out what to do. And again, we do not have a year to spend, nor do we need to spend that.
Right.
Okay.
Thank you, everybody. So next meeting, we're going to have a agency liaison discussion as well. There is the town council meeting. I know Barb is going to be there for the budget, and if anybody else wants to go to support, I don't think we should show up en masse. That'll feel like bull rushing our government. Exactly. And I'm sorry we ran over a little bit, but thank you everyone for really leaning in, and we'll see you all next month. Great stuff. Thanks.
Thank you.
Is Barb gonna watch this?
Great meeting,
yeah.
everyone.
Bye, guys.
I'm supposed
Good to
call
see
her.
everybody.
You do. Bye.